right to privacy or safeguarding public health? Which is more important, and should one come at the expense of the other? This is one of the biggest questions the world now faces. As the pandemic worsens, many countries have introduced the mandatory contact tracing systems and mobile apps to track and contain the spread of COVID-19. But will these technologies really help end the crises? What other consequences does increased surveillance have? To discuss these and much more, I'm pleased to be joined by Professor Chen Hong from the East China Normal University, and later on Wang Rong, senior expert at Tencent Research Institute, and Professor Alison Pollock, science director at Newcastle University Center for Excellence in Regulatory Science, and Dr. Kate Tulenko, CEO of Corvus Health. That is our topic. This is Dialogue. I'm Zhou Yue. Let me start with you, Professor Chen. There is a mobile phone-based QR code everybody's using to check whether he's risky or not to the public health. Have you been using the system, and what is your experience dealing with this?
Well, of course, I've been using it for accessibility, for example, into my place of work or other places. I think actually this code, this QR code, has been ubiquitously used to the effect of actually offering a kind of like easily accessible solution to the problem about checking and also verification of the health status of citizens in China, in various cities of China. I think actually this is a very important and quite useful app. Actually, it can really well to be used in various capacities. Not only about accessibility, about entrance into a place or living residential compounds. In particular, I think actually against the background that nowadays people are talking about this COVID-19 epidemic might be with us for a period of time. So that actually I think actually this QR code to be in use for a sustainable period of time.
And what is your general idea about using data and geolocation information about individuals to track a virus and contain a disease?
Yeah, the whole problem about this epidemic is about transmission and spread of the virus. So they're actually tracking, tracing, and also about the exact location of the transmission trajectory of the virus is particularly important. That is why I think actually phone-based, I mean smartphone-based apps like this actually can be of particular use in that it can really locate the location of a person, about suspected cases, about contacts, and also even about asymptomatic patients, so that actually people can really be on the radar of the relevant authorities about the possibility or potentiality of contagion.
But in the past, people seem to be very protective of their information, especially the positioning system information and where they've been, who they talk to. But now, do you think the pandemic has changed people thinking about the privacy of those information at all?
Exactly. I think actually this is exactly against the background of time of public health emergency. Against such a kind of extreme extremity, actually we need to take extreme measures. Of course, obviously, above all, this operation of the use of the data about the private data. Actually, there is also a mechanism that is actually going on, that is to oversee and also to regulate the use, accessibility, and also the use of those data. So I think on one hand, of course, data harvesting is very important. On the other hand, how to regulate and also to oversee the use, accessibility, and also the use of the data is also very important. But I think actually now the handling of the matter has been handled quite carefully and prudently.
We have another expert, Dr. Kate Tulenko, CEO of Corvus Health Online. So, Dr. Tolenko, we understand that a lot of governments and public institutions are considering using mobile phone-based information to track COVID-19 patients or those who might get into contact with the patients. And Google and Apple have announced their efforts to create a Bluetooth-based digital contact tracing system, which will automatically track contact between people. First of all, what do you think of this approach to contact tracing potentially COVID-19 infected people, and will it be useful?
Well, I think in smaller communities, you can still use the traditional forms of contact tracing by phone and by walking around neighborhoods. But once you get into larger cities, we're going to have to use the digital technologies. Just take Washington, D.C. 500,000 people ride the metro every day. And so if even one person who's COVID positive takes the metro, we're talking about needing to contact tens of thousands of people. So I do think it will be necessary. So the big question will be the ethics and the legality of it. Currently in the U.S., cell phone companies cannot turn over the data of any subscriber without a warrant, a legal warrant. And so people would have to do it voluntarily, or the law would have to change. I do think, given the the political climate in the U.S., that it would have to be voluntarily done. But I think that we can probably expect to see state or federal governments to create laws that ensure that this data is protected and is not used for other purposes other than the tracking of COVID positive people.
And the legal issue aside, Kate, isn't it the assumption that only if everybody and anybody is using this can we trace those contacts? If some of them refuse to use that app, it won't work that well.
I think certainly the more people that use it, the better, but I don't think you have to get 100% of people on board. It's kind of like the concept of herd immunity. If you have a certain critical mass of people who are using it, you'll be able to find the contacts, trace them, and put them in isolation or quarantine. So I don't think it has to be 100% of people. I do think one solution that would help is in certain groups that are reluctant, maybe due to a past history of civil rights abuses, you can have these groups form their own apps. For example, take Latin Americans in the U.S. There's a civil rights organization called LULAC, which they trust very much. And so if they created an app, you might find a much higher uptake in Latin Americans. And so I think you could do the same for other communities that perhaps are less trusting of these apps.
Let's bring Mr. Wang Rong. He's the senior expert, Tencent Research Institute. Mr. Wang, the system that used by Tencent and Alibaba here in China, the health code, how different is it from the Bluetooth contact tracing system by Google and Apple? And do you have similar plans?
Yes, we can make a simple judgment on which one is better or which one is more invasive. But a deep comparison between the two kinds of methods will help us learn from each other. The media often links the Bluetooth check tool launched by the Google Apple with the health code in China, making an analogy that a Bluetooth check tool is the world's largest health code project. However, after in-depth comparison, it will be found that there are big differences. Essentially, Bluetooth contact tracking program depends on the participation of the public health agency, but it still has obvious feature of decentralization. It's a way from the bottom to up. However, in China, the health code is a government-led centralized method. Yeah.
I want to talk a little bit about how the centralized system in China works. What kind of information does the companies collect, and how can it determine somebody is risky or not, or what kind of level of risks?
Yeah, at the beginning of the outbreak, the government considered the idea of issuing the printed passes to the residents for daily travel verification need. However, there are risks virus spread. So to meet the public management and people's workout need, technical companies just like Tencent responded actively. So the residents can apply for their own health QR code after their complete registration and declare their health status. And of course, in the back data set, the government can collect the public data to double check. It's like your name, your identification, identity card number, and the transportation card to double check. And you will get your own QR code.
And Ms. Wang, can you be more specific? What kind of information does that telephone number tell Tencent? For example, where he or she has been, who he or she has been talking to, or what she or he has bought. What kind of information does Tencent collect?
It's not just, it's essentially, I would to clear that the health QR code in China is a government service. So the Tencent will not collect the data. So the data controller is the government. The government to decide what kind of data to QR code. It commonly include your identity number card to identify your identity, and you can also to declare your travel history, but the government can collect the transportation data to check it.
And of course, a lot of people worried whether their information are well protected, because the government can collect such a large set of data, and how long it will be stored on the servers of the government, and will they be abused if there's any chances. What do you say to those people who have those concerns?
Yes, I understand these concerns that as common users they worried a lot. But as I mentioned before, to resolve these issues, essentially we must make a clear of what role did government and companies to play. As I said, from a data protection law perspective, in the health QR code program, the government play a role of data controller, which means the government makes decisions on what kind of data to collect and how to use them. So as a data controller, the government must respect the principles of the law, and the companies to support the technical support to the government, and they will also to follow the basic principles of the data protection law, and they must to take the priority measures to protect users' data protection, just like the encryption technicals and other security technicals.
I know you are also a law expert in this. What is the legal count of using information of individuals for public health benefits?
Yes. In my opinion, we don't have to choose between fighting the virus and protecting the privacy. We can do something that also makes very good sense with privacy. At the same time, get a better digital tool that will be very useful. That generally, data protection laws will not block measures taken against the epidemic. However, the basic principles of data protection laws should still be followed. So what we need to do is to find a balance between the public health and the virus protection. I think that a good example is the Bluetooth tracking project launched by Google and Apple. Although it can reach 3 billion users, they still follow the principle of the voluntary participation and the basic principles of the data protection. As I know that EU has made a statement that they support this kind of data track, and they just emphasize that they must follow the basic principles.
Okay, this issue is also drawn a lot of buzz on the internet. Let's look at what some of them have been saying about this issue. We've collected some feedbacks. This user said, data privacy comes with preconditions. Fundamental rights come first. When people are faced with a pandemic, a war, a natural disaster, they should give their data to ensure the safety. Of course, a system of tracking and accountability for the people who use the data should be established. But not private benefit is another precondition. So there is two sides of this debate. It seems this user agree that those information should be used, especially in the time of a public health crisis. So do you agree that maybe we should tip the balance a little bit towards utility and instrumentarianism at this time? Ms. Wang?
Yes, definitely. That the participations, just like the government and the companies, the technician companies, they must play well their roles. So they must also respect the principles of the law. So as companies, just like the Tencent, we processing the data strictly within the scope of the government mandate, and the data shall not be used for the company's own operation purpose.
And Kate, what is your take on probably we should establish the new balance between information, privacy information protection, and also public health information gathering?
So I think it's going to be decided country by country, and in the U.S., definitely state by state. Also, I think other considerations are there probably are people who can be mandated to use it. For example, I'm a practicing physician, so it would make sense for me to be mandated to use it because I'm high risk and I have a contact with a lot of people. The same perhaps could be said for certain essential workers. So we could see some mandates, but I don't think you would see a blanket mandate for use of one of these tracking apps.
But do you think people now have second thoughts about the balance between the two?
I mean, I think they do. And just to give an example, in the United States, the vast majority of people of European descent have at least one second cousin who has their DNA in one of these ancestry databases. So that means that if a person of European descent leaves some DNA at the scene of a crime, they can be identified. And this is the use of this data which was not intended. The DNA was collected so that people could find out what their heritage was, you know, what percent German they were, what percent Swedish, and it's now being used to solve crimes. So I think that's the type of concern people have. I think also people have concerns that the data might be used to track who goes to a political meeting or who attends a certain rally or protest.
And that information is not supposed to be shared by the public. All right, let's continue to look at what users have been saying on this issue. Let's roll our social media pages to see what others have been saying. This orange watchdog said, apps used so far offer no guarantees in terms of fighting the virus. This is a myth which can be used to convince people to adhere to apps. Is this voluntary? Will people remain unanimous to avoid discrimination? Apps cannot stop the virus. Human can by staying indoors. Well, he's basically thinking that those digital technologies is not a lot of help at all. So, Professor Chen, do you agree that actually those technologies are not a big helping hand, but it still needs a human intervention to contain an epidemic like this? Technology has no role to play.
Well, we're living in an age of technological revolution. Technology has been, changing the face of the earth, changing the way of life. So I think actually at this extreme time of, public health emergency, technology will definitely be playing a very important role. And also about apps, because apps is really, a kind of like, you carry your phone all the time, so that actually it accompanies you all the way, so that actually it can really monitor the trace of the latent, carrier of the contagion, and that can really be providing the best solution about the tracing and also tracking of the carriers. So I think actually technology is quite important, very important in this instrumental, in preventing and also to tackle and combat this COVID-19 epidemic.
We have another guest on the line. That's Alison Pollock, Professor Alison Pollock from the Science Director of Newcastle University Center for Regulatory Science. So Alison, it seems this has become a global trend. Singapore has been doing this. The UK, the National Health Service, is testing its own COVID-19 contact app. So why is each country trying to create its own version of tracking technology instead of cooperating on a single global platform? Or is it that even possible?
Well, I think the big mistake is that people are making is not to see this pandemic as not just a national epidemic in each country, but as hundreds and thousands of local outbreaks. And what we're forgetting, and what China and Asia did so well, was the shoe leather epidemiology, having people on the ground going out and doing the really hard work, which is identifying the cases, talking to them using old-fashioned telephones, not fancy apps, and recording and having real-time local data. And this is the skill and the capacity that we in the UK have lost and many other countries have lost. And we've got far too focused on the technology instead of thinking what are the public health essentials that we need to be doing, and then can technology help us, and if so, how? So I think
but you don't believe those kind of a mobile phone-based technology can better track those people who might be in contact with COVID-19?
Well, you have lots of problems. First of all, this is technology that's being developed for smartphones, and we know that most older people over the 65 actually don't either have smartphones and don't use their mobiles. And that's absolutely true, and that gets worse with even older people, and yet 80% of the deaths are happening in older people and vulnerable groups. We also have the issue of poverty and poor people. So that's the first issue, is can you actually get the take-up of these apps? Secondly, have we ever evaluated them to see whether they actually work in a country? I mean, we haven't even evaluated lockdowns. And thirdly, there's all the data governance and privacy issues. And that will, and who owns the data, who's using it. I mean, people will be very nervous about Google and Facebook developing apps, for example. I think what we can learn from the apps is the data that's required and collected, but actually that doesn't give you very much information at the end of the day. You have to do the hard work of the contact tracing, and that needs human contact and people talking to people, either on the phone or going door to door, as they have in China. And I think these are the things that we have lost and we need to be putting back, and we can learn so much from China and Singapore and Taiwan and Vietnam. And these are the skills that we've lost and we need to learn again.
And Kate, what do you want to say to Alison's argument that maybe the applicability capability and also the availability of those tools are not so promising? Maybe technology had been hyped.
Well, I agree that we do always need the shoe leather epidemiology. We do need the people going out. That's certainly true. And even though older people might not have smartphones, they basically get COVID from people who do have smartphones. So I don't think that's an issue. And even on the issue of poverty in most countries in North America and Europe, even poorer people have smartphones. So I don't see that as being a problem. So I do see the solutions as being a blend of the traditional shoe leather public health as well as some of the voluntary new technologies.
And Ms. Wong, a lot of people are saying maybe we can further develop this technology and use it in many different scenarios. Will it be repurposed for other uses? For example, what kind of data will we give away for better monitoring of our health? Where is the end of this?
In my opinion, we must respect the principle that when we we use this data, we must let the consumers know that it's a transparency principle. So from my perspective, it's still necessary to rethink and reevaluate the proportionality of the implementation any kind of tech measures. When you make technical measures, you must fully evaluate the risks and the benefits. A balance between privacy and public health must be re-established to prevent the normalization of emergency measures.
And Kate, do you foresee a day when we will give away more of our health information for an algorithm that may work better, or should I say best, for every one of us?
I mean, some of that's happening now with the Apple Watches and a lot of the health data apps where people are voluntarily giving away data. But I think when you look at the global burden of disease and what's actually killing people in the world, it's heart disease, it's cancer, it's diabetes and obesity. And so from that perspective, the most simple solution would be basic public health solutions such as sugary drink taxes or junk food taxes. And certainly in low-income countries, we need to improve water and sanitation. We need to improve access to vaccination and voluntary birth control. So there's a lot more that needs to be done that is not technology dependent. I think that one thing that's been very exciting in this outbreak is the sort of renaissance of research. And we're seeing the new vaccine technologies. I think that we'll probably have a vaccine for health workers by September or October, November.
Hopefully.
Because of the technologies are much faster. We're also seeing new materials technologies in the masks and the personal protective equipment as well.
And Allison, are you against the increasing rates and quantity of collection of data, personal data for health problems and coronavirus containment?
So, can I just be clear? Data is the backbone of public health, but what we've seen is a real diminution in the data that is being made available at local level to do the tracking and tracing. So we need data, but it should be public data, and it needs to have safeguards against it, against commercialization and control.
And who should be the safeguard?
It should be made easy for the local people, local analysts to access, and it should be made easy for public health researchers to access, but there need to be strict restrictions. And actually, this is not the best way of collecting data through apps. It's much better to do this through the, it has to be validated. You have to do very meticulous data collection. And we need that from the people. These need to be standardized, they need to be reliable. This is a huge, very difficult technical task to make sure you have good, reliable, repeatable data. And this is the data that we've been working on international standards for, as well as European standards for. This cannot be just done willy-nilly through an app. You are not going to get reliable data in this way. And then you have to have your healthcare workers trained up to collect the data and to enter it and to put it in reliably. We do that already within our community and health services. The problem is we've scaled back on this, and that's where the capacity needs to go, not into an app.
All right. On that note, we have to wrap up this edition of Dialogue. Thank you all for your take on this. You've been watching Dialogue here on CGTN. I'm Joe in Beijing. Goodbye.